Magnesium correction is done IV. Normal magnesium levels are 1.7 milligram per deciliter to 2.4 grams, of milligrams, and 2 grams of 50% magnesium sulfate ampule, which is commonly available, has 8 millimoles of magnesium, which is 16 millicoulomb. This is very important to know. And there's a oral preparation also in which 20 millicoulombs are present in around one tablet, which is 400 milligram of magnesium hydroxide. However, correction with oral can lead to diarrhea. The normal dose is 20 to 80 millicoulombs per day of magnesium in oral formulation, but we correct normally IV. So I've told you how much is there in the ampule. Now if you have to correct in an emergency, you give 2 grams, that is 1 ampule, diluted in 20 ml over 2 to 5 minutes. And this is in Torsade de Pointes most commonly. And you can repeat this after 5 to 10 minutes. The other emergency can be tachyarrhythmias of all kinds. Even with the normal magnesium, AF can sometimes respond to magnesium sulfate, and here again you can give slightly urgently. Other than that, if you have to correct, then you have to correct slowly. Do not give IV bolus because it gets washed away in the urine. Magnesium gets excreted in the urine very fast. So don't give a bolus, it's a waste. So when you have to correct magnesium sulfate, it has to be given in 250 to 500 ml, and you normally add 4 gram to 8 gram in 250 to 500 ml and give it over 4 to 12 hours depending upon the urgency. There is no clear formula, neither is there any formula to correct the deficit, to calculate the deficit. That is because magnesium is mainly intracellular, and when serum levels fall, one cannot estimate how much has been lost, and it takes time for magnesium to stabilize and distribute across intracellular deficits. So you have to, after giving the infusion, you have to check the levels after a few hours and then repeat accordingly till you nearly normalize it. When do you need magnesium infusions? So magnesium infusions are not routinely used for minor deficits of serum magnesium levels, but if there is symptomatic hypomagnesemia, that is neuromuscular symptoms, or cardiac arrhythmias, that, or sometimes ileus, then you have to give intravenous infusions. Or if the magnesium hypomagnesemia is very severe, it is less than 1 milligram per deciliter, then you have to give magnesium infusions. Also remember, infusions have to be reduced by 50% in renal failure because magnesium goes through the kidneys. And the other indications are tetanus, in eclampsia, and apart from that, it is also given in cardiac conditions